Hello, my name is Nakasero Angela. I'm a surgeon in Nakasero Hospital. What is the prostate? The prostate is an organ that all men have. It is located just below their urinary bladder. That's the simplest I can describe it. It is rounded its structure is majorly round. And as men grow, it tends to increase in size as well. Its major importance in the body is to produce a certain fluid that nourishes the sperms during reproduction, so that men's reproductive life is healthy. It is cancer of the prostate. And in Uganda, it is one of the leading causes. It is one of the leading causes of cancer-related deaths in men. The incidence rates are as high as 5.2% per year, and men are coming in late. You'll find that commonly it will begin at the age of about 50. So for those with a family history of cancer of the prostate, it tends to occur a bit earlier, like 40, 45, but commonly from 50 onwards. Initially, the symptoms are going to present a little bit in the same manner, and it is because of that men tend to brush it off until it is now more aggressive. It has affected the organs around the prostate, the bladder, the rectum, and the vertebral column, that they now come in. And because we're diagnosing it in older men, about 70 years, with existing comorbidities, and at already an advanced stage, we tend to lose them to the disease. The gene is already pre-existing, and then when it comes into play with environmental factors like alcohol, smoking, these factors exacerbate the rate at which this gene causes the prostate to become cancerous. So there is not one single cause of prostate cancer. Now that we're talking to men about this disease, monitor your urinary habits. We call them urinary habits. You'll find that as men grow and the prostate is also increasing in size, they will start to develop symptoms like frequency, going to the toilet frequently. And when you go to the toilet frequently, you're passing very small volumes of urine. So we have frequency, we have urgency. Urgency meaning that when you go to the toilet, every single time that you go to the toilet, you're badly off. Every single time, even if you had just gone. Then nocturia, you find that the gentleman is waking up many times in the night. Some of them actually urinate on bed. They have no control. So noticing these patterns as you age should trigger you to come into the hospital for screening. The biggest reason, and maybe the only reason really, why men should be vigilant about screening for prostate cancer is because early detection gives us really good prognosis. For patients where we detect it early and we're able to do radical prostatectomy, they go on to live their lives, they go on to live a pretty normal life. I mean, there are some side effects, but they are effects that you can live with and cancer-free. On the contrary, the patients who were diagnosing late, advanced age, advanced disease, 5-year survival rate is only 46%, which is very disheartening. My encouragement to our gentlemen, our husbands, our colleagues, our sons, please come into Nakasero. Let us check out that prostate as long as you're of age. It does no harm in knowing that it is a normal prostate, and it also does no harm in knowing that it's beginning to get diseased. Let's start the management early.